We knew that we needed to move towards what is now termed population health. 3 to 5 years ago, we didn't know that. We just knew that we weren't doing as well as we could, and that things that we were doing well in, we could do great in if we just had access to the data. The HR was not fully built out. It wasn't very flexible. The data was locked in and inaccessible. Really, though supposed to be an electronic health record, it really wasn't much better than an electronic chart, a non-paper chart. And so we had had some experience with Phytel with the Remind product that was very positive. Keying appointment reminders to the basic chronic disease management strategies was very powerful for us and got us a little glimpse into the inside of what it could do. And so we just knew we wanted to harvest that relationship and start exploring what Phytel could have delivered for us, or did deliver for us, with the data that was trapped in the computer. Well, Phytel has absolutely let us unlock the potential of the clinical information that we were busy gathering in patient care and busy storing for coding and documentation reasons, but not able to leverage it anywhere past that. So we were still stuck in the episodic model of caring for just the patient in front of you without any ability or data to become less episodic, more proactive, less reactive, more continual in our relationships with patients. And so Phytel has really been the harness past rudimentary IT-centric reports and spreadsheets that were never very actionable or tied to the chart, to let our clinicians and our care teams really start interfacing with their whole populations. Before Phytel, before the insight and the analysis that lets you take data to information, and then you tie the information with care teams, the care pathways that let you make the information an actionable information and intelligence. We knew we needed to fly somewhere. We needed to travel, and it had to be faster than a car. And we were on a bicycle seat with 2 biplanes, pedaling as fast as we could and not getting very far. And so the first meeting where I saw Phytel laid out before me, things that I had just dreamed of, were on the screen. And it was like jumping from a pedal-powered biplane to a 747. Phytel has been such a positive experience to work with, because the act of getting an analysis company hooked into your HR, getting all the data threads hooked up, connected, and working accurately real time is very intensive. I mean, it took weekly conference calls with IT teams week after week for quite some time to get it really working, but they were enjoyable. The Phytel people were exceptionally responsive. Concerns were quickly followed up, explored, emails back quickly the next day. So it really was a pretty positive experience, even going through the mechanics of making it hook up, which isn't my area of expertise. Extraordinary that they deliver on the analytics and population health quality insight that they promise they deliver on. Fairly extraordinary to work with, very, very positive, passionate people really trying to help us do better for patients every day, which is great to find a technology company that's got that passion for doing better care, because sometimes that doesn't flow to the IT side of our world. I do think to survive and thrive past the current model of healthcare, which, like I said, is reactive and episodic to the patient in front of you, one patient after another, 30 patients a day, to population health, continual quality improvement for your entire population, where you always know where every patient is for their important goals, and you're mindful in watching that as you take good care of patients one at a time every day. It really is absolutely required to move from the classic model of physician, single nurse with some ancillary support to team-based care. When you start listing the important things to do in a practice, which is, see patients, order lab, enter referrals, send prescriptions, all that stuff, that's the stuff that fills our time every day, 110% of capacity for almost all of us. The more important stuff about define and reach those women who haven't had their mammograms on time, to get all your young children their flu vaccines like they need, the things that really change outcomes on a big scale, not just one patient at a time, but for your whole population, is work that's not getting done. It's always, I'll get to it, and there is no more get to it. And so you really have to leverage past yourself, where the physician, the classic model where the physician makes every decision for every patient every day, to, I like the airliner model, where the physician is essentially the captain and leader of a highly disciplined expert team. That though the captain is still responsible for everything that happens on the plane, he's not looking over the navigator's shoulder and rerunning his math calculations. He's trusting his team to do the right thing every day, the same way pretty much every day. And so that to really use the information and analytics that our populations really demand, and the power of the information that Phytel unlocks, it really takes a team care approach to deal with all of that. As we started on our patient-centered medical home pilot, using the power of Phytel, we really wanted to build our healthcare teams bottom up. We said, we think, central administrative dictums, this will be your diabetic quality goal. This is how you handled women missing mammograms. Here's your information, you react to it. I just really firmly believe that wasn't ever going to work, because physicians and teams bring certain expectations, a certain practice culture that's unique to them in their setting, in their branch, with their partners and their patients, that really nobody centrally can respond and react to that appropriately. The other thing is, you really need the teams to get their arms around this concept of our population that we share and manage together. That can't be dictated or imposed on. That's a responsibility. It's a worldview or an outlook of how you see your patients, and that switch to it's just this patient and then it's this patient to it's all of our patients and we're all co-responsible for them is a cognitive, almost philosophical switch in how you approach your care, and that just can't be dictated. And that has been true, but we took it a step too far, and we tried to make the process of defining goals, of deciding, what's our definition of good diabetic quality, how we're going to approach every little step, even to the point of integrating analytics into the care process. We tried to drive all of that bottom up, where every decision was talked about, consensus reached after data was thoroughly analyzed, which is a wonderful, inclusive team model. But it's also extremely slow, extremely hard to react, and you get in situations where 10-2 is a tie. And that's hard moving forward. So I've really come to understand that I think for good population health and using the power of analytics to inform your care, it's got to be both top-down and bottom-up. And so the actual care processes, hooking the machinery of seeing patients up better and using analytics to inform your care, that stuff's got to be bottom-up. But I've come to the idea that I want systems to understand they just need to do the IT. You just find the system, get the bids, hook it up, provide compelling, accurate data, and even perhaps suggest a chain of workflows you could use to respond to that data, and then let the teams personalize it and make it fit for them and their patients. So I think the systems, the mechanics, the pieces the teams need to be bottom down, including vision, direction, resources, commitment to population health. But then actually using that and empowering care still has to be bottom up from the people actually seeing the patients. I think, having had my experience this last 2 years in approaching population health and using Phytel analytics to inform care, I tell someone that you need empowered care teams, you need supportive leaders with appropriate resources, and then you need information delivered, actionable, on time, every time.